Warm welcome to the World Council of Churches press briefing. Warm welcome to media present in this Zoom call from Madagascar, Lesotho, US, UK, Germany, Italy, Sweden, and Switzerland, and elsewhere. Some of you are also following us through the WCC website and the YouTube channel. All of you are warm welcome to this press briefing. We are gathered in the midst of the World Immunization Week organized by UNICEF. And from the very start of the pandemic, the WCC underscored its work and its messages that we are one world and one humanity that must live and act together in love and care for each other and for its creation. We are aiming at this 45 minutes long media briefing to take the opportunity to present the latest WCC initiatives to meet the health challenges across the globe. My name is Marianne Edelsten. I'm the Director of Communication for the World Council of Churches. I would say thank you to all journalists gathered today. You are very important to the WCC. Journalists, media outlets, and communicators, you are part of the frontliners during the pandemic. You are telling the stories of hope. You are handling misleading information. You are sharing information in a timely manner. You are very important for a better world for everyone. Our common task is to ignite hope to the world and bring best practice. And the press briefing today will try to give you a brief update. And we have a panel, and I have also the honor to present our moderator for the panel. That's Klaus Grue, a senior communication consultant with more than 40 years of experience in the field of media communication and crisis communication. So I would say, once again, warm welcome, and the floor is yours, Klaus. We have 45 minutes from now.
We do it again. This is very informal. I was muted. Thank you so much, Marianne. I'm very honored to do this. And I will start by briefly take you through today's agenda. We will start with letting a panel of 3 very experienced WCC representatives share their perspectives on WCC's engagement in health issues in general, and the current World Immunization campaign in particular, and the WCC's role in that. After that, which will be in about 17 minutes from now, we will open up for questions. We will conclude at around 3:45 by briefly presenting all vaccination champions. And again, I kindly ask all of you to mute your microphones throughout this briefing until you're invited to speak. This is a live stream session, and it'll be recorded, available on YouTube in case you want to go back and to any particular parts afterwards. That is very easy to do. We will also send out a news release later today summarizing today's session, and you will also have the opportunity to book interviews with the panelists. So just get in touch with us and we will try to set that up whenever it is convenient. So let me introduce the panel. WCC Deputy General Secretary, Professor Dr. Isabel Apawo Phiri, will begin with a general orientation of WCC's longtime commitment to health issues and its engagement in UNICEF immunization work. So, very warm welcome, Dr. Phiri. The floor is yours.
Thank you so much, Klaus, and my greetings to everyone. Yes, I want to start by stating that, health and healing have always been important in the work of the World Council of Churches, from its inception. And this is because of the mission of Jesus Christ that included, healing. So part of our mission is to promote healing. WCC facilitated the establishment of national level Christian health associations in several countries, especially in Africa, to promote ecumenical cooperation in health service delivery among different churches. So that's an example of the work that was done by the WCC to show its commitment to churches' participation in health and healing. WCC was heavily engaged in the primary health care movement, including the formulation of the Health for All by the year 2000 campaign. This is the campaign of the WHO, and we contributed significantly to that. And WCC also started an HIV program, even way long time ago, even when the others were not actively involved in it. It was in 1984 that the WCC made a decision to contribute significantly in the area of HIV and the role of the churches there. And WCC has also enjoyed a formal working relationship with the WHO since 1967. Now, coming to the present, since 2015, the World Council of Churches started implementing a project on churches' commitment to children in conjunction with UNICEF. It is then in this regard that we accepted the invitation to join the World Immunization Week to promote health and well-being of children and raise awareness of the need for faith communities to support COVID-19 vaccinations so that health workers can continue the routine vaccination of children around the world. And the WCC and UNICEF are celebrating 5 years of our partnership throughout this year. And we are very happy that this week of immunization is part of that celebration of our partnership. And WCC understands health holistically. For example, health is an issue of justice and peace, personal and community responsibility, spirituality, as well as the integrity of creation. In this regard, we are joining the World Immunization Week to promote health and well-being of children. Thank you.
Thank you so much. Thank you for that overview of the WCC's engagement. Very interesting, and I'm sure there will be questions on that later on. We will now continue with our second panelist, WCC President for Europe, Archbishop Emeritus Dr. Anders Wejryd, who will tell us more about what it means to serve as a WCC Vaccination Champion. Please, Anders.
Well, thank you very much, Klaus. That introduction was a bit of a surprise. I think it means that you should speak well of vaccination and give arguments why it is a good thing for the WCC to engage and for churches to commit themselves to this. But I think it's a good thing to start in a very basic ethical sentence and very general. Do to others what you want them to do to you. Mm. And don't do to others what you don't want them to do to you. I don't want to be infected by COVID-19, and I absolutely don't want to be the one that brings it on to someone else. I think that is the very basic thing. It is all about solidarity. Vaccination. Of course, there are risks with vaccinations, but those risks are minimal compared to the risks that follow from the infection, from the actual disease, which obviously is such a strange and difficult one. Some people go through it nearly without noticing, and others, being healthy and young and so on, are extremely badly hit. And therefore, I think this issue about solidarity is so important. Don't do to others what you don't want them to do to you, and therefore accept vaccination. And then I also think it is an important thing for us as Christians, and not least in the light of the historic churches and the ecumenical movement, we are all committed to commune bonum, the good for the shared word. It's not only about the faithful, it's about everyone. And God has given us science and reason. We know very well that science and reason can be used for very different purposes. But when vaccines have been developed and are shared, I think the resources God gives are being used for what God wants. Life, health. That is ends that we should be committed to. And then I think it is also important that the church speaks up about the equal and worldwide distribution of vaccines. It's so easy to be very nearsighted. But COVID-19 knows of no national borders. It moves across the world. And mutations seem to start or to come up where many are infected. And therefore, a wide rollout all over the world, where resources really are shared from those who have to those who have not so much, is extremely important. And we see that now when the situation is pressed, especially in India and many other areas. I also think that Christian people have reflected on living with risks. And I think we all have to realize that life is risky. But we can still be lifted up by a faith that says there is a good shepherd who wants to shepherd you, but it is risky to live. Thank you.
Thank you, Anders. And I mean, what it means to serve as a WCC vaccination champion is, as we understand it, to get these messages across, actually, that you have just shared with us, right?
So then I did my job.
Absolutely. I mean, it was I think this is very helpful. And we will get back with more information about the role of being a vaccination champion after the next speaker in the panel, who is WCC Program Executive for Health and Healing, Dr. Mwai Makoka, who will present a brand new Healing Promotion Churches Handbook and some other tools as well, designated to facilitate implementation of life-saving vaccination programs and other health initiatives. Please, Dr. Makoka.
Thank you very much, Klaus. And I will just build on what has been shared already by the two previous speakers. There was a consultation, which I should refer to, in 1964, a WCC consultation. In that health consultation, the key issue that came out there was that the healing ministry belongs to the whole church, and that specialized programs like church hospitals and clinics must reasonably be integrated into the life and witness of the church. And a follow-up consultation in 1967 affirmed that and highlighted that there has to be close collaboration and dialogue between theology and medicine. In other words, between pastors and health professionals. There was later a series of consultations in different parts of the world from 1978 to 1989. And these consultations, each one of them showed that there's a critical role that churches can play or were already playing in the area of health in all the regions. And we find out actually now that churches are already doing many health activities. Some are implementing directly, some are supporting overseas mission activities, some are running clinics and hospitals. So what we did in our program was to synthesize all these experiences and also the historical theological affirmations. And we developed a model that we're calling Health-promoting Churches. And this model prioritizes 4 interventions. The first one is health education, that churches, local church congregations should be places of health education. The other one is practical actions. The third one is advocacy for care, for creation. And the other area is public witness, taking a public stand on key health issues, each one in their area of influence. So these 4 key interventions have been highlighted, and we are building on this as a model for any local congregation. Health education, doing practical actions together, advocacy, and public witness. Now we have developed a number of reflections, and the one you have referred to comes in today, but last year we published what we call Reflections on Health and Healing for Churches on Commemorative Health Days. So actually when UNICEF reached out to us about participating in the World Immunization Week, we said, well, we already have some materials, some resources on World Immunization Week. So that set of reflections has all the major WHO commemorative health days, one of which is the World Immunization Week that we are commemorating now. And the other one is a handbook to accompany churches in establishing and running sustainable health promotion ministries, which you can see there. And we also have an ecumenical COVID response work, which we developed last year, that outlines key bottlenecks that churches can plug in and address and participate in national responses to the pandemic. I will stop there. Thank you.
Thank you so much, Dr. Makoka. There appears to be a number of very useful tools developed already. And this is, of course, nothing new for the World Council of Churches, which has been engaged in these issues for quite some time through the Health and Healing Program. And I'm sure there will be more questions to you in a little while, because now it is time to open up open up for questions. So I will hand over to Director of Communications, Marianne, to lead that session.
Thank you very much, Klaus, and thank you very much to the panelists. And now I open the floor, and you could either raise your digital hand or your physical hand, depend on the technical requirements you have on your screen, or write in the chat. So who want to ask the first question? And maybe you could introduce your by name and your media outlet, and if you have a particular question to one of the panelists or all 3 of them. Do I have a question from Simon Barrow? The floor is yours. You have to unmute yourself.
Thank you very much indeed, Marianne. I'm Simon Barrow. I am director of Ecclesia, which is a think tank and change network, and used incidentally to have a lot to do with the WCC through Churches Together in Britain and Ireland. I was some time back Associate General Secretary. So thank you for all that you're doing. My question relates to the broader context for the excellent contributions we've had so far. This week we've seen a statement from 145 religious leaders, including Christian leaders, about the whole question of inequality around vaccines, access to vaccines, and the people's vaccine. And so my question really is how the World Council of Churches might be responding to that. There's now a People's Vaccine Alliance that has been set up with world leaders and faith leaders and others involved in it. And they have two particular demands in the current situation. The first is about pharmaceutical companies openly sharing vaccines and know-how and doing that through the World Health Organization's COVID-19 technology and access pool. And the other is asking governments to suspend patent rules at the World Trade Organization on COVID-19 vaccines and treatments and testing during the pandemic, and breaking effectively the monopoly of just a small number of both countries and companies. Will the World Council of Churches be involved in that, or is that something that happens through its member bodies? You know, what are people's responses to those kinds of critical issues?
Thank you very much, Simon. I think I will address this question both to Isabel and Mwai. So maybe you could have teamwork in responding. And which one of you prefer to begin? Isabel, please unmute yourself. Floor is yours.
Thank you very much. I would prefer that, actually Mwai responds more to that one. But I just want to say that as soon as vaccines were available, WCC made a statement already to encourage the equal distribution of vaccines, because WCC stands for those, who are the disadvantaged in the society. So if we would support, anything that promotes equal distribution of vaccines to all countries, so that every person who needs to be vaccinated should receive the vaccine.
Thank you, Isabel, Dr. Phiri. Then I will invite Mwai, Dr. Makoka.
Yes, we worked with the World Jewish Congress toward the end of last year, and they produced a joint statement on equitable distribution of vaccines and all the other legal issues which have been raised. And also the beginning of this year, we produced another statement, which was with Christian health associations and Christian health organizations globally, where we were also urging for equitable availability of vaccines. And these, many of the signatories were able to take these statements to their national governments. So there we are with you. And the People's Vaccine Alliance, they actually reached out to us after that statement had already been released. And they were a bit disappointed that they reached to us a bit late, but we have been attending a couple of their meetings already. So we support that. Thank you.
Excellent, thank you. I'm very glad to hear that, because I did sort of wonder why the WCC wasn't involved, but obviously that was in a sense not your thing. But it's very good to hear that there will be that engagement.
Thank you, Simon. Then I will invite John Haberman. Please unmute yourself. John,
can you hear me?
Yes, please. The floor is yours.
Okay, great. Yeah, first of all, many thanks for giving me the floor and organizing this press conference. My name is Jan de Kerbermann. I write for EPD News Agency in Frankfurt, Germany, and I'm based here in Geneva. Yes, it's basically a follow-up to Simon's questions. Probably it would be, or sort of a little statement, probably it would be quite helpful to reiterate this statement on the patents and the intellectual property rights discussion at the WTO, because as Simon rightfully mentioned, many journalists didn't know where you stand, and because we couldn't find anything. And I basically I prepared the same question as Simon has asked now, but I have another one. And this here we are, we are now more than 100 days into the global vaccination campaign. And now you start your pro-vaccine campaign, a very convincing one, but isn't it a little bit too late, 100 days or almost 4 months into it?
Thank you, John, for your question. Maybe I will also address that to Mwai. The floor is yours, Dr. Makoka.
Yes, so we wouldn't exactly say we are starting the campaign now. As we've shown that we have had several publications which we are circulating to our constituency. But we have taken the opportunity of the World Immunization Week and our partnership with UNICEF to amplify two key issues. The first key issue is that the stagnation in childhood immunization, which has been observed, there are fears that actually that may get worse with the COVID pandemic. So we are making a very special appeal that people should encourage and ensure that there is adequate vaccination of children, especially those under the age of 2. All the vaccines, childhood vaccines must be completed by the age of 2. And the issues which Professor Isabel mentioned, wars and conflict, they prevent adequate coverage in children of vaccines, and also misinformation and some beliefs and vaccine hesitancy. And then the second issue is actually the uptake of and availability of the COVID-19 vaccine. So we can look at our campaign now, or our activities now, as re-energizing that ongoing efforts. Thank you.
Thank you very much, Mwai, for that response. I don't have any other questions from the team of journalists in this Zoom call at this moment. Anyone else who want to ask a question? Otherwise, Klaus and I have also received a few questions from outside. Maybe, Klaus, we should take one of the questions to our champion.
Thank you. Yes. We have a question here. Which I think you have already answered, actually, regarding raising awareness of immunization programs. But there's also another question, and that is, in what way has the pandemic and our efforts around that affected other WCC programs and priorities? And how can and will you make a difference by being a vaccination champion?
Thank you, Klaus, for that question coming from outside. So we address that to our president, Archbishop Anders Wejryd. The floor is yours.
I have never been very impressed by authorities, and I'm afraid that no one will be impressed by these authorities either. But at least raising these issues in at unexpected times, when we are together with other people, is, I think, important. That people understand that ethics, religion, medicine, and economics and politics, they interfere. And here it is about life and health. And if we as church leaders do express that, it might make some difference, and it might upset some people, and that is also an important thing.
Thank you very much, Archbishop Anders. We have another question from Huguette. The floor is yours, Huguette.
Thank you, Marianne. I was just wondering how you will be able to convince the local churches and the leaders, the church leaders, that the vaccination is really an issue that deserves to be involved in, and it is really a matter of life or death. But I don't think that they are very interested in this issue in the Middle East, actually.
Thank you, Huguette, for that question. I will address that to, in fact, all three of the panelists to respond. And maybe could begin with Isabel Apawo Phiri, also coming from the African continent, where we have also been facing the same situations from time to time.
Right, yes. In the case of Africa, we have learned a lot from dealing with HIV. When HIV started, the churches were completely against, any form of involvement, and their messages were negative, and bad theology was floating everywhere. But slowly, through our HIV program, we concentrated on helping the churches to become HIV competent, and that meant, giving correct information about HIV, and then discussing with them correct theology related to diseases in general, and in particular HIV. Within, I don't want to say within months, but we managed to turn things around so that, churches have now become champions on dealing with issues of HIV. Issues of compassion and correct theology are undergirding the church's responses to HIV. So using that example, we know it is possible to correct the theologies that are out there that are making the local churches to be resistant to vaccination, and especially on the issues of COVID-19. So we believe that, we have a mission out there. And in fact, there are also many more churches that are supporting vaccination and are sending out correct message. So it's to strengthen those ones that, are responding positively, to go on a mission to help others who are struggling in understanding, vaccination from a Christian perspective.
Thank you very much, Dr. Phiri. Should we turn to Archbishop Anders Wejryd? What would you respond to that question?
Well, all the responses I had were covered by Isabel. I think she gave a very good example that is trustworthy, because we have seen that it is possible. But basically, it is about responsible and experienced theology, where health, life, and religion are kept together.
Thanks, Archbishop Anders. Should we turn to Dr. Makoka? What would you respond to the question?
Yeah, in any case, now only to add that we will count also on our partnerships. And this is not only the task for WCC. As I mentioned earlier, our joint statement with the Jewish community. And there are many other Christian organizations that are working in Africa and also other parts of the world. So historically, if we look at that, we are part of a bigger team of actors. And also, when it comes to behavior change, many times we assume that, okay, when people know, they'll do the right thing. But between knowledge and action, there are different steps there. And we need to understand those steps and take our communities along with us. And one of the aspects is actually a methodical way of appreciating that the hesitancy, maybe there are genuine reasons. So instead of dismissing those reasons, we tend to approach them and appreciate those reasons, and take people from just information to a good intention, and from intention to action. And it's along that path that actually leading by example comes in, where even when people have known the truth and they're convinced, sometimes need a good example, to actually trigger them into action. So the champions come in at this point, and many others who are keen to set a public example in their respective communities. Thank you.
Thank you, Mwai. Then I will turn back to Simon. You have a second question. The floor is yours, and we will try also to solve the technical problems for Esther.
Thank you very much. Yes, I don't want to take questions away from anyone else, but my question, which I put in chat, but I'll just explain a little more. I mean, given the challenge of COVID is undoubtedly and undeniably a global challenge, any notion that in some parts of the world we can sort of forget about others falls apart, because we all have to be part of the solution, or we will all suffer in different ways. Though, of course, the impact upon the rich and the poor will be very, very different. That's the danger of the situation. So given that global challenge, and given that it's rooted in other global challenges, such as the human relationship with the natural world, I mean, this is why we are likely to see other pandemics following, unfortunately, unless we can change that. There are international challenges. Now, what we've seen in recent years is the growth of nationalisms which have undermined international institutions. For example, the United States is now reconnecting with the World Health Organization, but there was a very damaging few years. And this, unfortunately, is still around in parts of Europe and elsewhere. So my question really is, what role can the WCC as an international organization itself perhaps play in helping to strengthen the international architecture that we will all need in order to address both COVID and the other global challenges that arise from this?
Thank you very much, Simon. Which one of the panelists will start to respond? A smile from Mwai. Do you want to? Okay, first Dr. Makoka, and then Archbishop Anders, and finally Isabel will finalist.
Yeah, what you have said is extremely true. That is why we support the catchword building back better, because the pre-COVID time, there are other people in the world who are genuinely want to say we don't want to go to the pre-COVID time. Others are crying for the pre-COVID time, but for many other people, the pre-COVID time was not even better. And building back to that would be for them a missed opportunity. We have had this crisis, and after this crisis, they are taking us back to exactly where we were, where the inequalities and the disparities and all that are basically continuing. So it shouldn't be just a reset, pressing the reset button. But the point you have raised is also very true, because building back better is not going to happen automatically. Just because everybody is vaccinated, and then airlines are now flying again, and then somehow it will be better. It will not be. So there has to be very active, very deliberate engagement. And we need to know the actual pressure points. And you have highlighted a number of pressure points that have to be actively managed. And I would also highlight that this particular task is much bigger than one organization, is much bigger than one church, is much bigger than one country. So global solidarity has to be expressed. We need to find ways of working together and harmonizing our voice, and not only harmonizing the voice, because we have to find new ways of working, new partnerships. We might have to recalibrate, reshape our organizations, how we decide on profit and loss. We have seen a world where values of companies are based on speculation. Just one statement, they say shares have gone down. Nothing has changed, just one press statement. How do you mean I've lost billions of money because of one statement from one person? So it's the way the economic system is working. So that also has to be questioned and recalibrated. I will leave there. Thank you.
Thank you. Then over to Archbishop Anders.
I think it is important that we dare to talk about God is the one that has given life to all. God is the one that upholds the life of all. regardless of if you know God or not. I mean, the basic thing that we are all responsible, regardless of ethnic background or belief, to someone superior. I think that makes a difference. Then I think it is extremely important for us to review our organizational structures when it comes to international organizations. The WCC has gone through a crisis that when we found out that majority rule doesn't work. You need to have more of a conciliar fellowship. And this is a difficult path to enter. And I think a number of organizations have to review their way of decision making in order to become more respected as international gremiums.
Thank you, Archbishop Anders. Over to Isabel, and then we will close the question and answer session to move on to the presentation of the champions. The other.
Right. Here, I want to emphasize the importance of the World Council of Churches working together with other faith communities to do advocacy at the international level, national level, regional level, on issues of a better world for all. I want to give an example of, the COP, which is coming very soon. Already, I have seen, that the WCC is working with other faith communities to prepare statements that will be presented there, to argue for inclusion of everyone on issues of climate change. But we also know that climate change does not stand on its own. It's connected to issues of economy, and it's connected to issues of our health. So as we deal with the pandemics in general, it connects us to the way we are responding to issues of climate justice, economic justice, and working together for a better world for everyone.
Thank you very much, Isabel. And to those who hasn't had the chance to ask questions, it's possible to request for interviews afterwards. We are available and will find a way that you will have the answers you need. Over to Klaus to present the other champions.
Thank you, and thank you for all the interesting responses. And there are obviously a lot of challenges still ahead of us, but undoubtedly spiritual aspects are very important, and acting in solidarity and compassion. And as mentioned earlier, the WCC has appointed Vaccination Champions to engage deeper in these issues and to promote immunization as a powerful tool to save lives and livelihoods. And the other champions we will present now here on the screen. So we have Reverend Professor Dr. Johan Sauka, who is also the Acting General Secretary of the World Council of Churches. And we have Reverend Gloria Ulloa Alvarado, WCC President for Latin America and the Caribbean. And of course, Archbishop Emeritus Dr. Anders Wejryd, whom we just heard, WCC President for Europe. Reverend Dr. Firon Mwombeki, General Secretary of All Africa Conference of Churches, is another champion. And then we have Dr. Jørgen Skov Sørensen, General Secretary of the Conference of European Churches. And we're also pleased to acknowledge that Mr. Jim Winkler, President and General Secretary of the National Council of Churches of Christ in the USA, has signed up to be a vaccination champion. Along with Pastor Peter Noteboom, General Secretary of Canadian Council of Churches. And Reverend James Bhagwan, General Secretary of the Pacific Conference of Churches. and Dr. Matthews George Shunakara, General Secretary of the Christian Conference of Asia. And that was all of them right now. As you can see, people from all over the world joining in to work as vaccination champions. There are tools, very helpful tools here that we would like to also share with the media. These are social media cards with quotes from each one of the vaccination champions. These are readily available and on social media, and they are also presented on our website, where we have actually in the past week or two published a number of articles and news releases covering these issues, where also all these quotes have been presented. And the links will be shared to all of those, but you can find it on our website. I think, and there's plenty of material there about our engagement in the World Immunization Campaign, as well as health issues as such. Over to Marianne. Thank you.
Thank you very much, Klaus, and thank you very much to the panelists with Dr. Isabel Apawo Phiri, Archbishop Anders Wejryd, and Dr. Mwai Makoka. Thank you very much for being present and answer on questions and inspire the world to take action. And thank you very much to all the journalists and communicators present in this Zoom call or elsewhere. We're here to serve you. Thank you very much. And we wish you all the best and God bless you in your important ministries. Stay tuned and we might meet online again in a press briefing. This has worked out very well. So thank you very much for coming.